treated free of charge under emergency Medicaid.
Yep.
What I'm saying is it's a good principle for somebody who's truly here in an emergency.
What does that illustrate?
It illustrates...
It's one example. B, presumptively, that man, if he flew into JFK, came in on a visa and has resources. Yeah. So that's not an illegal immigrant. So I don't understand.
I'm explaining the fact that emergency Medicaid is very abused, and it is galling to Americans, as you heard before, who were in the emergency room. They're trying to figure out among their families how they're going to pay for the ambulance, how they're going to pay for the emergency care, and then they see somebody get it for free because they claim they have no insurance.
It's the medical bills are expensive. That's not because of illegal immigrants. That's the claim that people are making. Healthcare is expensive. Healthcare needs to improve in this country. There's a way to do it, but the fault of it is not illegal immigrants. When people go to hospitals and have to wait hours in the emergency room, you know why? Because when you pass a bill that closes rural hospitals, you have to drive, and it consolidates the amount of patients. When doctors have to work extremely long hours, you know, my mom just had a heart procedure. The doctor had to do 50 heart catheterizations in one day. Do you think that's not because, let me tell you, not one person he did a heart catheterization on that day was an illegal immigrant.
I have no idea,
question,
but the question is,
I'm not finished. Thank you. Abby's question was, is this a way that Republicans are just using illegal immigrants to deflect the conversation?
And the answer
is yes.
No, it is
it's yes,
not. You
because
refuse to look at the facts.
Illegal immigrants are not the reason why our healthcare system is broken.
Yeah, it's not deflection at all. In fact, I brought receipts. So here's the CMS, the Center for Medicaid and Medicare Services, right here with their press release earlier this year saying they were having to increase their oversight on states like California who were abusing Medicaid and classifying it as an EUSA, an emergency system, when it wasn't. You've got the average state spends 5% of its Medicaid roughly on emergency services. California, 35 to 40%. Why would that be? Because California passed a state law that says we will fund Medicaid for illegals, and then, oh, by the way, we'll raise our provider taxes, and then, oh, by the way, we'll use that as a match to draw down federal funds. And they're using this whole cavitation process.
An accounting trick to put it on the taxpayer.
Money is fungible, and California's loophole is abusing it.
Listen, and we addressed this, and I addressed that in the monologue that I just read. But the bigger issue that is at hand here is that come the end of this year, regular Americans, not illegal immigrants, and probably 99% of those people, not immigrants at all, are just going to see their premiums, their co-pays, their deductibles go up.
Which expires when? It expires at the end of the year.
I know, I just said that. At the end
totally
of this year.
Different issue.
Well, no, hold on. It's not a totally different issue because that is the issue that is at hand.
No, there are two issues, two separate issues. One is what to do with the subsidies for the Affordable Care Act. They were emergency increases, and now they want to make them permanent. And the other is what to do about people like people with temporary protected status, temporary parolees, people who didn't wait the 5 years to be eligible for Medicaid.
I'm glad that you said that because you also just illustrated another really important part of this. That issue that you just raised about the loophole with
California,
with blue states, is also not at the heart of this issue.
It is.
It
absolutely is. That's why page 57,
the subsidies that are eligible,
repeals the language.
The eligibility for subsidies for people who are here, who are immigrants, who have TPS, who have those other statuses, those are not illegal immigrants.
But Abby,
let me point out that they would have been considered illegal immigrants.
Page 57 of the Democrat proposed spending bill, Section 2271, repeals the language that would deal with the loophole. Why would they even have that in there? What's the purpose of having it in there? Because they want it back in place.
But not because of illegal immigrants.
Yeah,
illegal immigrants cannot
because of illegal
say, give me health care.
They can't.
Unless they're dying.
If you turn an emergency room into a free clinic, it happens that way.
I don't think you can prove, and I don't think Republicans have proven this, that what they're characterizing as a loophole, which is basically saying we're giving you money and you're using the savings to provide other services. That would be true theoretically of all kinds of different federal funds.
Ro Khanna announced it the other day on an interview on this network. I mean, it's absolutely what he said.
You know what word we haven't used in having this conversation? Death. Die. People dying. I want you guys to imagine a kid playing with a soccer ball. Kid has a seizure. Parents grab the kid, rush the kid to the hospital. Kid gets to the hospital. Parents are worried, sick. Kid's about to die. Somebody runs out and said, "Where were you born?"
No, that's different.
Nobody's arguing about that.
Nobody's arguing that.
Nobody's arguing
what
about
you're
that.
arguing
That's
about.
the Hippocratic Oath.
They're arguing about the abuse of the system.
Hold on. It's exactly what you're arguing.
No, they're not.
Because
They
in
are
your
not.
perfect perfect
not at all.
world,
No.
that's what has to happen.
That is not true.
In your
That is not true. The sign in the hospital says everybody gets treated.
In your perfect world, that's what has
That's
to
an
happen.
accusation I reject. No,
what
it's
what
not
has
true.
to happen in your perfect world is
No.
we have to decide.
There's a reason that we played that J.D. Vance sound, right? Because he was the one who, when it was asked about this issue, brought up what happens in emergency rooms. He said that it's not fair that when you go into an emergency room, there are undocumented immigrants that get health care that is paid for by taxpayers. So that's the scenario that Van just brought up.
Can I just say he did not say that? He did not say that. He said people who did not speak our language. You cannot. It was a comment unworthy of the Vice President of the United States. What about these people who are in the emergency room, who look different, who sound different, and they're getting health care before me and mine? That's what he said, trying to stir up the worst kind of emotions. The CBO reported last month this whole problem is less than 1% of the cost of Medicaid. Now, you can say we should get after that 1%, but it's less than 1%.
1% of $900 billion is a lot of money.
Absolutely. I'm not going to deny that. But you know what's a lot more money is doubling and tripling the premiums that people who get their insurance through the Affordable Care Act. That's what Republicans are afraid of, which is why they're throwing up this
That's a different issue.
Here's what I would say. I mean, look, there are no easy answers in this, right? If you are trying to save money, people are going to get hurt. But I think that at the core of this is the question that I asked at the beginning, which is, why can't you just tell the truth about the policy issues at hand?
You know what
why do we have to then, why, Phil, why do Republicans have to just say noun, verb, illegal immigrants, and then feel like the conversation ends? Why not explain to the American people that, you know what, your premiums are going to go up, and that's the cost of the big, beautiful bill?
Well, and I tell you what, let's go back to what you just said a minute ago. Let's talk about the reality is just pass the clean CR, the same one you voted for back in March. Why are we having to extend 4 weeks with $1.6 trillion in additional spending? Why would you stick that into a CR?
Here's the thing.
I get it, but let's say they do
Pass
that today.
that and keep government going and pay the
Premiums are
troops.
still going to go up.
It's not hard.
And are Republicans going to own that?
This is the thing.
The premiums are still going to go up, right?
That's
You know
right.
what? That's the regular order of
The
business.
additional
Just,
That is
I
a
mean, I'm
separate
saying, like,
piece of
from a
legislation in the
political
regular order of
perspective,
business, Abby.
just own the policy,
That's
right?
right.
The policy has really nothing to do with undocumented immigrants. It has to do with just regular
Because people
Americans
don't want their
and how much they pay
issues,
for
and
health
you're
care.
trying to
But this is-
conflate them, but they're
No.
very two issues. One was that the Affordable Care Act provided additional subsidies during COVID. They were passed as temporary. Now the Democrats want to make them permanent forever, and the Republicans disagree. That's one issue.
Sure.
It's a legitimate conversation. How much of the tab should be picked up by taxpayers? The other one is about people coming into the country and getting health care right away at a large expense. And I agree, they're not all illegal. But remember, under Joe Biden, several million people were brought in under temporary protected status and parole. They were equivalent to illegal in the sense that they didn't wait the 5 years like other newcomers have to wait to be eligible for Medicaid.
They were equivalent.
They were equivalent. So now you get to rewrite the law.
Yeah.
Because you don't like it.
No, I'm explaining what he did.
This is the reality. This is the reality. In 2024, when Democrats lost the election, we sat at this very table, maybe not this configuration of people, but I was told there was a mandate. The Republicans had a mandate that they were going to be able to govern and do whatever they want. We'll do what you want. Pass the bill. But you can't, because you know why? It's because it's not popular. And when people actually find out
We can't, because
that
it takes
they're
60. It takes 60.
But then it's not a mandate.
That's
Those two things can't be true.
you
So
can't-
can't have, and if you don't have,
Democrats
and if
lost
you
the
don't have a
election.
mandate, and if you don't have a mandate, then you have to negotiate. And if you don't negotiate, then you cannot govern.
I think it's
and if you
extortion what they're
cannot,
doing.
no,
All right.
if you cannot govern,
Extortion.
then you are not a
When you
leader.
close down the government, it's extortion,
just
not
a final-
negotiation.
Republicans cannot
Just a final
govern.
word. Just a final word on this. Okay, look, a few
can't pass a bill.
recent polls looking at who's to blame. It is interesting to me that despite all of this back and forth, most Americans say either Republicans or both sides equally. And so those are the numbers that we're going to continue to watch as this shutdown continues. And unfortunately,